Philipp Mergenthaler, Berlin Institute of Health. Machine learning for personalized immunotherapy in rare neurological autoimmune disease.
Thank you very much for the opportunity to present at this exciting conference. Myasthenia gravis is a rare neurological autoimmune disease where patients develop autoantibodies against parts of the neuromuscular junction, which is the connection between the nervous system and the muscles. These patients typically present with muscle weakness of the eye muscles, of the arms and the legs, or of the bulbar muscles, which causes problems in speaking, swallowing, chewing, and breathing, which can be a life-threatening condition. Now, I should point out that many patients can be managed well with a standard immunosuppression, but it may take quite a long time, sometimes several years, to stabilize these patients. However, about 20% of these patients have unstable disease. They can progress into myasthenic crisis, which then requires intensive care treatment, and about 10% are refractory to any standard therapy. When we looked at our own patients, we find that we can stabilize and bring these refractory patients down to standard therapy levels with a non-standard immunosuppressive drug, rituximab, which targets the antibody-producing cells in the immune system. So in collaboration with Health Next Gen, a data analysis startup company in the United States, we're now trying to identify patients who would benefit from an early non-standard immunosuppression based on a deep phenotyping approach using all available healthcare records. Now, this is a very early project, and in the first step, we're trying to identify features, mostly at the moment based on lab results that can discriminate rituximab-treated patients from standard therapy patients using machine learning approaches. And in this part of the project, we used data from about 11,000 hospital admissions of myasthenia patients in the United States. And we find that next to age, a range of immunological markers, mostly several immune cells, highly discriminate these two different patient groups. So based on these data, we're very confident that in the end, we'll be able to find predictive parameters that will help us in making personalized treatment decisions for the immunosuppressive treatment of our patients. Thank you very much.